So to follow it, you go the external iliac, and it comes down through here, and it turns in. Once it leaves the external iliac, once it leaves the inguinal canal and goes into the femur region, what do you think they call it? It becomes a femoral. As it comes down here, right behind, before it bifurcates, right behind the knee, what do you think they call the artery?
Popliteal.
It's the popliteal artery. Then it bifurcates, and it goes into fibular, posterior, and anterior tibial arteries.
Come on.
All right? Fibular goes out laterally, tibial stays medial, one anterior, one posterior. And as you come down into the foot, you actually get into what they call the dorsal pedis, which sits, the dorsum is what? Is the dorsum the top of the foot or the bottom of the foot? Top, dorsal. Here's and come down through here and it goes into the dorsal pedis, which is the top of the foot. And from there, then it goes down into different branches. So eventually you end up with the digitals. So you have a dorsal branch, you have a plantar branch of arteries, and then they go into the digital arteries, and at the digital arteries is where the capillary beds are in this particular model. Then they reverse, and they come up, this is not a great model, it's kind of been fractured. Then they come up through the digital veins into the plantar and or dorsal venous arch, which then come up into a multiplicity of possible areas. And this is really messed up. So let's take a look. So once they actually, you can't see it from where you are. So once they actually get into the venous arches, they can go one of two different ways. They actually have three ways of coming back. Now, remember that the arteries only have one way to get to the tissues. The venous structures can drain multiple ways. There are alternate pathways for the venous structures to drain the blood back to the heart. And you have to know the alternate pathways. So there's the hard pathway, or the slow one, which means it comes up through the posterior tibial, into the popliteal, into the femoral, and eventually up into the external iliac. Or you can take a little faster route, which is on the lateral side. You go into the smaller saphenous, which comes up into the femoral. Or the fastest route is taking the greater saphenous vein, which comes all the way up here, right up into the femoral, into the external iliac, and then zips right up into the inferior vena cava. So as you go through these, as you study these, study them in sequence, because then it'll be so much easier for you to learn to trace the drop of blood. And if you look at the arteries sequentially, they're all named anatomically. Okay? So, what are the three arteries that come off of the arch of the aorta? You already know this if you study the heart. You have the right what? Brachiocephalic. You have the left common carotid, and you have the left subclavian. So looking at this artery here and this artery here, this is going to be brachiocephalic, this is going to be left subclavian. And this one right here is going to be the left common carotid. So this shows you the right brachiocephalic, which turns into a subclavian. This goes directly into the subclavian, doesn't have a brachiocephalic. Which is confusing because on the venous return, the venous returns right before they go into superior vena cava are both brachiocephalic veins, right and left. So don't get confused with the veins and the arteries. There's only one artery and two veins that are brachiocephalic. Let's look at the upper arm. It's the same thing. You have these, well, let's just take the brachiocephalic that goes off to the right. As it comes up, it goes brachiocephalic, then it goes below the clavicle, and it becomes subclavian. Then it goes down over here, and it becomes axillary, because it's right underneath the arm. Then it goes into this area here, and it becomes brachium. Then it bifurcates into ulnar and radial. Once it comes down here, you're going to see that there are multiple arches. You have a palmar arch, a dorsal arch, and a median arch. They go in from there into the digital arteries. Then they're picked up by the digital veins. The venous structure, again, has multiple ways of taking the blood back. Digital veins to palmar and venous arches, multiple ways. You can take the hard way, which would be either the radius of the ulna or the median up into the brachial, or you can take what they call the cephalic or basilic that bypass all of that and come up here. The second fastest is the basilic. The fastest is the cephalic, comes all the way up into the brachial up here, and eventually axillary, subclavian, and brachiocephalic. Those are the extremities. Now, coming off of the heart and going up into the head, there's two main routes. One is going to be the left common carotid, and the other one's going to be the right common carotid coming off the right brachiocephalic. These two large arteries going right up here to the lateral sides of the thyroid cartilage. You can feel them. They come up to a certain point, and then they bifurcate. One goes internally, and one goes externally out here. You can actually see the external one coming out on this, which takes you to the temporal arteries and so on. The internal one goes up in through what foramen? Or what canal?
Carotid.
the carotid canal of what bone?
The sphenoid.
Temporal bone. All right, so it goes up in the temporal bone, makes that little right-hand turn. Then it comes up and it goes into something called the circle of Willis.
Ooh.
The circle of Willis is kind of a fail-safe mechanism at the base of your brain that allows the blood to flow around the base of the brain in arterial form. So in case you have a stroke, or if there's some collapsing, or if there's occlusion, or if there's some plaquing, that it doesn't stop it completely getting from the brain to the brain, which we'll talk in more detail in just a minute. So you have internal, external. Internal goes up, goes to the carotid canal into the circle of Willis. Now those are the two main structures taking blood to the brain, but there's two others. And those two others are coming off of the right brachiocephalic and the left subclavian. And these are called the vertebral arteries. The vertebral arteries we talked about before. You can see the vertebral arteries because they come right off the heart and they go right up through the what?
Intervertebral foramen.
The foramen, the transverse foramen of the cervical structures.
Oh.
So they go right up through here, form around, and then they come into something called the basilar. Excuse me. So you have the vertebral arteries come from this, and they form the basilar artery. The basilar artery then leads into the circle of Willis, and it goes around that little circle. The basilar artery, when you have two arteries that come in to form one, does anybody know what that's called?
Confluence.
It's a fancy Greek word. Starts with an A. Say it louder. Anastomosis. So when you have two arteries that come into one, that's called an anastomosis. The basilar artery, which sits right at the base of the brain, is a common area for aneurysms. What is an aneurysm?
It's a rupture of an artery.
It's actually where you have a dilation of the arterial walls so they get so thin
Dissected.
that sometimes, upon certain pressure or high elevation of blood pressure, they burst. And unless you're in the operating room and the neurosurgeon knows exactly what just happened, you're going to die. There's no way they can stop it. So whenever there's an anastomosis, you increase the possibility of having aneurysms, and the basilar artery is a common location. How about the drainage? Well, we already know in studying the thallic cerebri that what is in the thallic cerebri? What is that vascular structure? Tyler?
Cord.
Davis? Remember that blue thing that went around? On the top, we call it the dural sinus. Well, what was that thing right below it called? It's a sinus, but what was it called? Now you're going to UC Santa Cruz. You're going to know this. It's called the superior sagittal sinus. It's a vascular structure that is draining the blood from the meninges in the brain. There's also an inferior sagittal sinus. There's a straight sinus, an occipital sinus, and all these sinuses are draining blood from the brain, and they all dump eventually into the jugulars. Here is the jugular, here's an external, internal jugular, so the internal jugular drains the brain, the external jugular drains everything that the temporal, the external carotid feeds. They both come into the jugulars come back into the brachiocephalics and go right into the superior vena cava. All right, so this is just a brief review. How about in between here and here? We have all the viscera. So what are we going to name this viscera? I'm going to turn it around just a little bit. You have to know kind of some of the names of the viscera. Here's the diaphragm. Anything below the diaphragm is abdominal, everything above is thoracic. You're going to see that there is, well, actually, see it better on the front. Over here we have an artery and vein going up into this structure. This is called the liver, but what else do we call it? It's a hepatic. So this is the hepatic artery and vein. Then you see this out here. What is this way out here?
Spleen.
Spleen. So this is the splenic artery and vein. And then you have the kidney over here. Instead of calling it kidney artery and vein, we call it renal artery and vein. Okay? So you have hepatic, renal, splenic. And then you also have one that's hard to see, but right on top, that little, everybody kept calling this adipose on your lab. What's that little thing on top of the kidney?
The adrenal gland.
The adrenal gland. So,
It is
the adrenal gland has the adrenal arteries and veins. Now, there are other things that you may have to know, and I haven't checked out your veins yet, but some of the arteries you're going to have to know about the hepatic portal system. You have to know about the, there is the testicular artery and vein, there is the hemizygos, the azygos, all different ones you'll have to look at. You'll see this coming down by the sternum, and these are all intercostals that come back in between. I'm not quite sure how detailed they want you to get, so let me take a quick look. Where did I put it? Right here. Let's kind of go through this real quick. So we covered the, under page 34,